Well, let's bring one of the key people in on this. Dr. Rob Lawrenson co-chairs the Junior Doctors Committee at the BMA. Thank you for coming on again, Doctor. Can you explain to my listeners why you've chosen these dates? Good morning.
Good morning, Nick. So we have chosen these dates because on Wednesday, with the announcement of the general election, we demanded an immediate meeting with the government in order to settle the dispute on Friday, end of day. Unfortunately, the government threw its hands up and refused. They refused to table that alleged final offer that Victoria Atkins said she had 6 months ago in December. And so we had no option but to call for further strike action.
The Health Secretary is claiming that under Cabinet Office rules, the government's unable to negotiate in the same way as it can if there's not a general election on. Why not respect that, or why not wait?
So, end of play Friday, they were able to make an offer, which was what our demands were. Now, at the moment, our demands to call off this strike are slightly different and are still in the power of Rishi Sunak. What we're asking for is for Rishi Sunak to make a commitment, as he's been making commitments over the last few days, to setting out a credible offer to a route to pay restoration that gives confidence in our committee that it will be implemented should he form the next government. And that would be enough for him to say for us to call off the strikes.
What would he need to say? Just nail that down again, if you would, Doctor.
So he would need to present a credible offer on a route to pay restoration, which could take some time, right? We're happy for this to be occur over a few years, of which gets to pay restoration and gives the confidence of our committee that it will be implemented should Rishi Sunak form the next government.
Now, you obviously don't need to necessarily play this out in the court of public opinion, but even as I'm speaking with you, Doctor, I'm having emails and texts and X's or tweets, whatever one calls them, which is saying this is clearly a political decision. It's blatantly playing politics. I can read you out if you like. How would you respond to that charge?
Well, I think I do feel a little bit sorry for the Health Secretary and the Prime Minister when they think that this is some sort of coordinated effort or plan. I mean, it's beginning to show that they're struggling under the stresses of the job and their poor decision making, because there's a clear rationale for the turn of events that led up to the announcement, and it's all logistical based. It takes time to organise an emergency meeting. It was a bank holiday. We had a meeting late on Tuesday evening. The debate lasted for multiple hours, and then Wednesday morning was the next earliest opportunity that we could make an announcement. Our dispute's been running for 20 months. This dispute could have been ended long before strikes, but we were told before strikes by the Department of Health and Social Care that until we have a mandate and until we have strike action, there's no point talking. This was always their plan. They never wanted to settle this.
You honestly want my listeners to swallow the medicine that this is not in any way politically motivated, Doctor?
No, not at all. We've been clear for 20 months that we're asking for a route to pay restoration.
So over all those 20 months, and I apologise talking over you, but over all those 20 months, it's just pure coincidence that the latest strike finishes 2 days before we go to the polls, just by pure chance.
This is the first strike of our third mandate, a mandate which we secured on the 20th of March. We haven't taken action for almost 3 months, and actually we've been trying to negotiate in good faith. But as I said, Victoria Atkins had an offer, allegedly, in December, and has never tabled that. That is a really cynical move from the government.
Lastly, that's this government. If there is a change of government, is it likely that there would be further strikes under a Labour administration, Doctor?
Well, that's for the Labour government to decide. If they want to sit down, negotiate properly, and get a route to pay restoration.
Well, you know what the Shadow Health... I mean, you're a very bright bloke. You know what the Shadow Health Secretary is currently saying. He's not going to give you 30+% overnight, but he wants to talk about phased over years. I wonder your reaction to that idea.
That's quite literally what we've been saying from day one. We want a multi-year pay deal. There's documented evidence, there's television, there's radio, there's print media, that we've been saying this for many, many months now. So yes, a journey to pay restoration is acceptable. Okay. We're not expecting it overnight.
Grateful for your time, Dr. Rob Lawrenson. You co-chair the Junior Doctors.
When I was working as a trauma and orthopaedics SHO, there's a shift that I don't think I will ever forget. Now, on my trauma and orthopaedics job, there was meant to be 7 of us on the rota. The shift I will never forget is the one where I was the only one who turned up for work that morning. So remember, at this point, we only had 4 people working a 7-person rota. And one of them was scheduled to be off work and 2 of them called in sick. So it was just me by myself. That was a disgustingly horrible day. Because I was with my consultant doing the ward round. I kept getting called by A&E. I couldn't go down to see the people who had broken hips and broken bones in the emergency department because we needed to get through the ward round and deal with the patients on the ward, try and discharge as many of them as possible so that the people who were in A&E, we could just free up some beds and people could come up to the ward. I remember I kept getting bleeped and called from A&E and from other wards, and I just wasn't able to go and see everyone. There was no one else around that could help me. Everyone else was busy doing their own work. And I remember there was one point where it was about 2:30 p.m. and I hadn't had a break. Had just been working from 8 a.m. that morning. And the nurse in charge of A&E called me and she said, "I'm going to have to escalate this to your consultant." I was like, okay, that's fine. I just handed the phone to my consultant who was standing next to me, who said that there's literally nothing that we could do. It's just super busy. There's not enough staff. Next thing I know, about 30, 40 minutes later, one of the operations managers came down to have a chat with me and was like, "Why aren't you going to see those patients in A&E? Why haven't you discharged all of these people?" At this time, we'd finished the ward round and had tended to all of the really sick patients. And I was just trying to crack on with all of the other jobs and the workload that had arisen from the ward round. I was just like, there's one of me. I can't split myself into multiple people to be able to tackle everything that's going on in the hospital. I can only do what I can do. It's nearly 3:30 now. I haven't had anything to eat or drink since before I started work now. It's been horrendous. And eventually I ended up being at work that day until 10 p.m. because there was so much work to hand over to the night doctor. I couldn't leave them with all of that. So I stayed on for a while longer. And one of the main reasons was that after all of that ward work and dealing with all of the sick patients, I went down to the emergency department and I started seeing those patients there. It was heartbreaking because there were people there with broken hips and they'd been waiting for me to come down so I could administer an injection into their hip to basically numb the pain before they were to have an operation the following day. It was just, I felt so bad, but there was not really much more that I could do. But they were stable and they were in the emergency department, which meant that if something were to happen, there were doctors around who'd be able to treat them and manage them. And whilst that is a standout day for me, it doesn't make me forget the times where I've worked a 12-hour shift and then I'm handing over to a night doctor and then suddenly during handover, I don't know, we get bleep from 3 different places saying these patients are all really unwell and need a review. Like, I can't just leave them. I have to stay and have to go to help out and see one of those patients, regardless of how tired I am. Because the dangers of not going would be someone could become really unwell. Someone might die. So the workload is disgustingly high in the NHS. There is a lack of appreciation for what doctors do. People can say that doctors are paid highly, but the pay has been eroded over the last 10, 15 years. So the junior doctors are not looking for a pay rise. They're looking for their pay to be returned to the level that it should have been if they had not had below inflation pay rises of either 0%, 1%, 2% over the last 10 to 15 years. And at the moment, there's a mass exodus of doctors. People are leaving to go abroad. People are leaving to work in health tech or in pharma or in any other industry other than working within the NHS. And it's really sad.